Diagnostic test plays a role or a huge role in treating a myocardial infarction. Once a patient complains of chest pain, it's considered an emergency. An electrocardiogram must be performed right away within minutes of arrival. So every emergency department has its own protocol or chest pain protocol, which is an EKG on arrival and must be read by an emergency physician or a cardiologist within 10 minutes. In addition, cardiac workup would include complete blood count, D dimer, CMP, BNP, ASR, CKMB, cardiac troponins, as well as radiologic examination like X-ray and CT scan. Cardiac troponins are highly sensitive and specific. However, its elevation would only be noted 6 hours after onset of MI. So if a chest pain onsets like an hour or two during a patient's arrival, it could be negative, and troponin would remain elevated for as long as 14 days. So CBC could rule out infection, also could rule out anemia. D-dimer elevation could mean pulmonary embolism. It's very sensitive to pulmonary embolism. A positive D-dimer, we could now proceed to do a chest CT angiogram to determine if the patient indeed is having pulmonary embolism. And BNP, which is also sensitive or positive with patients having congestive heart failure. Erythrocyte sedimentation rate, RESR, could indicate inflammation or infection. CKMB, as well as the cardiac troponins, are positive or would normally result positive in a patient with myocardial infarction. So the most important thing is EKG right away. It is 77 to 100% specific for a patient who's having MI. So it's important tool to determine if patient needs cardiac catheterization or reperfusion with fibrinolytic drugs. So an elevation in ST or a deflection of 1 millimeter above or below the isoelectric line of ST segment would indicate myocardial ischemia or injury. Also, chest X-ray would determine if patients having pneumonia, also hemothorax or pneumothorax. So those are the diagnostic tests that we could perform in a patient who's having chest pain or myocardial infarction. Thank you.